Hello, everybody. Welcome to the Natural Food Pantry Education Initiative. Joining me today to speak about pain and inflammation is my guest, Dr. Kate Rheaume, Naturopathic Doctor. Dr. Kate Rheaume is a graduate and former faculty member of the Canadian College of Naturopathic Medicine. As an educator, Dr. Kate speaks internationally on many topics related to health and wellness. She is the author of the best-selling book, Vitamin K2 and the Calcium Paradox: How a Little-Known Vitamin Could Save Your Life. Welcome back, Dr. Kate. It's always such a pleasure to have you with us at Natural Food Pantry.
Thanks, Natasha. Great to be back.
So inflammation and pain are really common amongst our population today. It seems like a lot of people struggle from inflammation and pain quite frequently. And it can be, I know from experience, it can be really draining, it can be taxing, disruptive to lifestyle. And because of the resulting pain, I think a lot of people associate inflammation, they think it's such a negative thing, but sometimes inflammation can be part of the body's defense mechanisms and can really help to stimulate the healing process. So can you explain a little bit the difference between helpful and problematic inflammation, as well as the relationship between inflammation and pain in the body?
So you're right. Ultimately, inflammation is meant to be, or was designed to be, a healing process. It's something when the body has been injured or infected or irritated, or there's some problem that needs to be solved. The body will produce these inflammatory compounds that are part of the healing process. And once the inflammation is resolved, the infection, irritation, injury has been healed, then anti-inflammatory compounds will be produced, the inflammatory ones will go down, the healing is resolved, and the cycle is complete. Now that's when inflammation is working perfectly. But there's times when it doesn't work perfectly. Now we know this intuitively, because if anybody who's had an injury, let's say, your typical sprained ankle, how's your ankle? Well, it's still a bit swollen. And we know that means the healing hasn't finished. And so that is something I think people understand intuitively. But the problem is, when does helpful inflammation become harmful, or what's the difference is certainly inflammation that's lingering, it's not resolving, maybe it's waxing and waning, it hasn't completely gone away. Then those are signs and symptoms that the inflammation maybe is becoming to a chronic state, or your body doesn't have what it needs to heal and complete that healing cycle. And so those are some of the things, length of time, as well as intensity, or, for sure, whether it's spreading, are some things that may tip us off to it's becoming, the inflammation itself is becoming a problem, because as part of that healing process, there's actually a little bit of damage created while we're clearing away some of the damaged tissues, and that process needs to finish, or else there may be problems.
Right. So when should inflammation be addressed, and what's a good starting point for addressing chronic inflammation in the body?
Mm-hmm. Certainly, if it's something that, depending on the inflammation and the condition, there are time frames that we can understand to expect a healing process. But if your inflammation is extending well beyond that, then that's a sign that maybe you should be considering what other factors might be contributing or exacerbating the inflammation. Maybe you need to be taking extra steps to help the healing process, and of course we can talk about those. So again, time, lingering, as well as if the inflammation is really starting to interfere with your quality of life, the inflammation itself is becoming a problem rather than a solution to a problem.
Mm-hmm. And the pain from inflammation, that's the part that can be really, taxing and draining and disruptive, unpleasant. So a lot of people will seek pain relief medication. Understandably, they're desperate for that pain to be resolved. And pain medication has a time and a place. And, sometimes it's helpful to treat short-term, to mask those short-term symptoms, but it's not treating the underlying cause of the problem. And it could possibly, I understand it can possibly cause side effects. So can you speak a little bit about that? It's not addressing the root cause, the root of the problem, and what are some concerns related to these pain medications?
Mm-hmm. Pain medications, you're right, they do absolutely have their time and place, and they can be I'm very thankful that we have them. They can be wonderful when you really need them to use them. However, they are typically, the over-the-counter pain relievers, things like acetaminophen and ibuprofen or other NSAIDs, non-steroidal anti-inflammatories. Those are the two main classes or categories of pain relievers that people will use. They are definitely meant for short-term use only. And by that, you're looking at typically 2 weeks. Unless there's extenuating circumstances. These are not meant for long-term ongoing use. And I mean 2 weeks of daily use. So if you're taking it once a week, you're popping some ibuprofen before you curl once a week just so you don't feel your knees. That's one thing, that's a bigger picture story. But acetaminophen in particular is really tough on the liver, very, very hard on the liver for long-term use. Again, not a daily use more than 2 weeks. And ibuprofen and other NSAIDs medicines in that class are really hard on the kidneys for long-term use. So both of them, neither of them are great long-term options.
Mm-hmm. Mm-hmm. So what are some good alternatives? Do you have any suggestions for natural remedies that might help people?
Yeah, there definitely are. Certainly there's diet and lifestyle factors that contribute to our inflammatory load, but there's also a number of natural anti-inflammatories. So they help to either promote natural anti-inflammatory compounds or counterbalance or lower the inflammatory ones. Ones that top the list include curcumin. This is probably the best known and best studied and arguably the most effective natural anti-inflammatory. A lot of people reach to this and use it, and it's something that can be safely used over the long term. That's the nice thing about this option and the natural options typically. There's also something called PEA, palmitil ethanolamide, and that is in supplement form, typically derived from, can come from a variety of plant-based sources. Legumes is the source often used for supplements, and it actually works on the body's endocannabinoid system, which has pain-relieving receptors throughout the body. And so that's something interesting, and it's particularly for longer-term use. It's specifically indicated that for nerve pain. Nerves may be firing pain signals, maybe if we don't even know why. That's a nice option. As well as omega-3 essential fatty acids. Although not directly, I don't think of them as pain relievers, but having these in the diet will help shift the whole inflammatory process in the body towards anti-inflammation versus inflammation.
Mm-hmm, mm-hmm. So the fish oil can be taken as prevention, as well as when somebody is experiencing inflammation. Can curcumin and PEA be taken together?
They can be taken together. Yes, they have quite different mechanisms of action, different ways that they work, using different receptors and parts of the body. And so, most people will benefit or derive the benefit they need from one or the other. And there's some, different indications for one versus the other, but they can be taken together.
Okay. Okay. I know for some people they need to experiment a little bit, try one, and if it does, I know there's certain symptoms that will might benefit more from one of those remedies, but I know some people just need to experiment and try one, see how it works, and if that doesn't work so well, then try the other.
Exactly. And some people just respond better to one than the other.
Exactly.
That's the way we are. Yeah.
Exactly. Wonderful. Well, on May 25th, you're going to be back with us to do a webinar on pain and inflammation. Can you tell the viewers a little bit about what they can expect to learn?
So we'll be going into a lot of what we've already been discussing, but in greater detail and more sort of useful, practical news you can use, including diet and lifestyle tips, which ones promote inflammation, which ones can help reduce inflammation. That's really important, can make a big difference. As well as the effects of stress on inflammation. That's really important. And natural remedies to help relieve inflammation, which ones are the best ones, how they work, how to take them, all that kind of practical info.
Amazing. I've seen you do a presentation before on inflammation, and it was so well received. It was really, really well presented. So I'm looking forward to having you back. I really encourage people to sign up. And on that note, for viewers who would like to sign up for the webinar, just pop onto our website at naturalfoodpantry.ca. Visit the classes and services tab of the website. You can register for any upcoming event there. You'll find Dr. Kate's upcoming inflammation webinar on our website. And I encourage you to follow us on Facebook, Instagram, YouTube. You can also subscribe to our newsletter at naturalfoodpantry.ca. Get invitations to our events sent right to your inbox. Thank you so much, Dr. Kate, for joining us again. It's always a pleasure to have you with us. Thank
You're
you for
welcome,
sharing your knowledge.
Natasha. Thanks. Great to see you.
You too. Take care. Take care, everybody. Bye.